Hi, everyone, and welcome to Crushing Doubts Q&A every Monday at 6 p.m. Eastern, 3 p.m. Pacific. I'm living the dream that I once had when I was a chronic pain sufferer, and I just wish there was someone out there who could answer all my questions. So I decided to go get all of the answers, figure it out as best I could, and I did even far beyond what I ever expected I'd be able to do. Figured out a lot of the answers, and I'm here to talk them over with you. So always exciting to be here with you guys. I'm here on YouTube, Instagram, and Facebook, and wanted to talk about how you can get the podcast, which, of course, is how many of you discovered me. There are going to be some shifting things coming up. I think I've mentioned them in my newsletter, so if you get the newsletter, I certainly have let you know about this. But we are now going to be available as an audio podcast on Spotify for $5.99 a month for all of the new content. The old content is still going to be available where you had it before on Apple Podcasts. But if you want the new content, which is now out and flowing, we're getting back to it. It's going to be on Spotify for $5.99 a month, so check it out. As far as the audio podcast, we are moving to our own network called the Sapphire Network. It's going to be a network that is based on societal change, a lot of mental health stuff. And of course, I will be spearheading a lot of that. You can check us out on Instagram, find us under Sapphire Network, and hopefully you will like us and follow us and keep track of how to join to get the new content as it comes out. The seminars, there is a change I wanted to announce. We're moving from May 2nd to May 9th. We're delaying it a week for various reasons, but wanted to let you know about that. That's going to be at 4 p.m. Eastern. And if you can't get that live, you can also get it on recording. As always, it's on www.crushingdoubt.org. My membership groups are rolling right along. We're getting great answers to a lot of great questions. And in fact, that's a big part of how I figured out all this stuff. It's from the questions, not only that I ask, but also that you ask. And other than that, the only other update is the book's coming along. I'm close to getting done with my edited version. And actually, if there are people out there who do line or copy editing, I need somebody who's really interested in this work who would be willing to work with me on that. So if you're interested in that, please reach out to me at dan@crushingdoubt.org. Okay, enough with the announcements. We've got some questions. Let's roll right in. Looks like we have some people who have joined on Instagram, though, that I want to say hi to. We've got Catherine Toomer, Lucy Oden, Retrospections Vintage. I always have trouble with that name, even though it's a really cool name. Positively Whitney has joined us. How to Heal Chronic Pain. That's Scotty says hello. Good to see you, Scotty. Carrie Nordling, good to see you. And Michelle, great to see you as well. All right. Thomas Rogers says, hi, Dan. Thanks for your help in the group meeting today. Here's a follow-up question about the suggestion you gave me. Did you suggest thinking about how I would live my life differently if I didn't have symptoms so that I could see how I'm letting my symptoms control me, which would let me see what the powerful move in each moment is so that I can regain this control over my life? Also, let me know if I misunderstood your suggestion. Okay, so it's really interesting because any answer I give is often about a particular moment or a particular articulated doubt or a particular emotion. So I want you guys always to think that way, because when I answer one question, it may not apply specifically to you or to a question that even relates to it, because there could be some differences. Now, what Thomas is referring to, and he was in the group, and I appreciate you sharing that, Thomas, because it makes me free to go ahead and talk about that, is that he really has crushed out a lot, but he was finding that he's trying to figure out what to do with certain lingering symptoms or even how to think about them. What I was saying to him, which is very common, is that when people are mastering doubt, they start to what I call approach the power column, meaning they're starting to have the bulk of their work be in the power column, which is really where you want it all to flow towards. And I was saying to Thomas, I think there's some power column work to do here. And he said to me, well, okay, but I think I'm in a pretty powerful place. And I don't think he's wrong about that. But what we pinpointed there is that actually there's a difference between being generally powerful and having all of the ups and downs that come in the power column. All the things where you can feel powerful one moment and not powerful the next. Happens to me all the time. I'm sailing along feeling powerful. I read somebody's response to a Facebook post of mine that's not good in some way, and whew, the power comes down. There's lots of ups and downs. And so what I was suggesting to you, Thomas, with that question, actually, it's funny. I don't totally remember specifically what I was saying there, but reading what you wrote, and so how you interpreted it, I was more thinking that by looking at how you'd be living your life without the symptoms, I'm more helping you take a global step back to talk about with yourself, do I feel powerful in my own life? The symptoms often can get in the way of you assessing what is going on in the fullness of your own life. So you said, I'm just going to go back and read what you said. If I didn't have symptoms so that I could, did you suggest thinking about how I would live my life differently if I didn't have symptoms so that I could see how I'm letting my symptoms control me, which would let me see what the powerful move in each moment is so that I could regain this control over my life? Okay, what you said is brilliant and right on and a part of what I would want, but it's not actually the reason that I said it now that I think back to it. The reason I said it is because I wanted you to recognize that not so much how are you being controlled by the symptoms, but more, are you living as powerfully as you want, independently? And sometimes we need to remove the symptom life from it. So it's not so much about seeing how the symptoms are controlling you, but getting a glimpse of power in relation to yourself that has nothing to do with the symptoms. And that can be, I shouldn't say it has nothing to do with the symptoms because it can play out in a power column sort of way. But I just mean there's a separate assessment of whether you're feeling powerful. So in a given moment, that thing I just mentioned about a Facebook post, for example, that doesn't have to do with symptoms, but it does have to do with power. And then if my power goes down, then a symptom could come from that. So I like to track power separately from symptoms. Thomas, let me know if that makes sense of your question. Sorry if it was a little meandering, but there's a lot of good information in there, hopefully, nonetheless. Okay, Bob, good to see you here. Bob said, I worked through doubts, felt 100% clear. Core narrative shows huge list of trauma. Symptoms intensified, felt confused, hit wall. Feels like subconscious repressing unknown doubts / trauma. Ideas to help unblock the subconscious. Okay. This is one of those questions that, as many of them are, where I might need to ask you questions, Bob, to get to what it is specifically you're asking. But I also can take a stab at it, and then I want you to follow up if I didn't hit on it. So there's lots of reasons that you could hit a wall, but this is all screaming power column to me. This seems to be, I would say, not so much about something that's repressed in the kind of emotions department, or even unknown doubts, or even unknown trauma. This is speaking to me, just the way it's profiling, like you've done really good work. You're pushing doubt, to its limit. You're making lots of progress, but I'm not sure you feel safe to be powerful. So when you say ideas to help unblock the subconscious, what I want to tell you is I'm not even sure this is entirely all that subconscious. I think this is about bringing it more to your conscious mind, an idea that maybe you didn't even know existed all that much. Now, we've talked about it, Bob, so you do know about it, but I want to help you know about it a bit more. And the idea is this. Society tells us not to be powerful. We get messages from everybody to not be powerful. And so it can be quite scary to go ahead and take a step out and do that. And I think what I'm seeing here, because this is what I would describe as a plateau. You've gotten better to a certain point, then you got stuck. Then doubt came in. Confusion is one of the forms of doubt. You felt like you hit a wall. That all speaks to a plateau. To me, it is about power. And the question is this, Bob, what do you think might be holding you back from feeling okay about feeling powerful? And I'm going to give you an example. I'm not saying this applies to you. I have no idea, pulling this out of thin air. But for some people, they feel that they better not get powerful because somebody that they care about is going to really not like it, and they may lose that relationship. Again, total example out of thin air. That may not apply, Bob, but it's the kind of thing that is a roadblock. I don't think this is all that subconscious, actually. I think when you get the idea to just think about power and whether you're okay with it and why you would not be, you're going to get answers there. So, Bob, let me know if that helps. Mark R. is saying, hi, good to see you, Mark. I was with Mark earlier. He's doing the training with me, so thanks for joining me here, Mark. Let me know if you have any questions. Bob said, I've never had power ever, lifelong, hard to feel or sense. Yep, total fear. All right, so Bob, here's what we can do. you don't have to go all the way. You don't have to become super, super powerful. What I want you to do is to start thinking of little ways that you feel not so powerful and start inviting yourself to make some kind of adjustment to that. How could I feel more powerful? As an example, you could be standing in line about to order something and realize that you tend to order things in a, kind of worried sort of way. Maybe you say to yourself, you know what? I'm going to give myself the chance to not worry about what this person thinks about me, and I'm just going to say what I want. That's a very small power adjustment, but it could be huge. It could really change things. And Bob, I want you to start building in little things like that. It's hard to be powerful at first, but it becomes fun. It becomes freeing. And what I can help you with, Bob, is to understand the ways in which you didn't realize you even have options to be powerful and maybe didn't see it. So I want you to start thinking about little ways that maybe you could be more powerful. And let's discuss. Bob, follow up with that, okay? All right. We have some questions coming in from Instagram, and then I will get to Mark R's question on YouTube. Okay. Retrospections Vintage says, hi, Dan, enjoying the seminars. Just about to start day 4. This is Justine in Australia. Justine, good to see you here. Just want to clarify peptides. They can just cause the pain, or they can also cause actual physiological changes, or both, I guess, just wanting to get off neural pathways. Okay, peptides can do anything. Anything that the body is capable of doing, peptides can make happen, any of it. So it can cause pain. It can cause pain receptors to fire. It can cause soreness in muscles. It can cause anything at all. Peptides are, for those of you who don't know, they are the messengers that brain cells send to every part of the body to tell other cells what to do. They're the equivalent of neurotransmitters, but neurotransmitters go between brain cells. Peptides go throughout the body. And there was a woman, Candace Pert, who wrote a book, Molecules of Emotion, which I found out about through Dr. Sarno, because it was mentioned in The Divided Mind. That, to me, was very key in explaining the physiological mechanism by which the brain can control every cell in the body in every way that it wants. But it often is causing actual physiological changes. It can cause inflammation, as an example. Now, you said you wanted to get off of the neural pathways argument, and to me, that's actually very important. Neural pathways are real. People do tend to go on the neural pathways that they're used to, and that can get really repetitive. But are they actually grooved or hard to change? Not with the right information. Absolutely not. If you don't get new information, yes, that will be kind of the default setting. But new information radically changes that. It's kind of like when you see something, you can't unsee it. So neural pathways, to me, has it all backwards. Not all backwards, but what it describes, interestingly, is it's almost like taking structuralist theory and applying it to the brain. Now we've got a structure in the brain that we can't change. They're just doing the same thing that doctors are doing with the body's structure. And the reality is it's all very changeable with the right understanding. Justine, let me know if that makes sense to you and if you need more to follow up on. Okay, David Arazi, good to see you here. Let's see. Scotty has a question, and then I'm going to get back to YouTube. Okay, Scotty says, literally overcame a symptom imperative today and observed some things. Foot pain for 3 days. I couldn't stop thinking about the pain, attentional TMS, and fear was high. Okay, so attentional TMS is my term for when you cannot stop attending to the symptoms. Happens to lots of people. Then he said, solution was to detach from the catastrophic thoughts and label the thoughts as just thoughts. As well as to have literal self-compassion to the pain. Speaking to the pain as if it was my inner child. So this is the kind of solution that we're looking for. And it's going to vary person to person and even moment to moment. We've got to get some way that you can change your thinking that works for you. And Scotty found some solutions that work. So detaching from the catastrophic thoughts and just labeling them as just thoughts. In a way, that's what I call observing doubt. You are not buying into it. You're backing up and saying, these are just thoughts. I don't have to believe them. That took away their power. So that was well done. And then he moved on to another solution. which is to have self-compassion to the pain, speaking to the pain as if it was my inner child. Another way I would put that, Scotty, is I think you were kind of experiencing the pain as a communication. It was expressing something to you. Now, actually, when I think about it, I think you did something slightly different than what I'm saying. What I'm saying does help. But what you did is I would call this a power column solution. You found some self-empathy. You understood the kind of the fullness of your trauma. And you were focused on that. Now, attentional TMS, I say all the time, when it's kind of obsessional in nature, you want to work in the power column. That's exactly what you did there. So lots of good solutions. There's hundreds of different solutions. And we have to find what works for you at given moments so you can build that system. Okay. Rita has joined us here as well. Hazari Ma has joined us. And a follow-up from Justine. She says, sorry, I guess for clarity, peptides can do anything. Create sensitive or pain sensation when it's normal. And then she said, yes, thanks. So I think that I answered your question, Justine, but please do tell me. But just to clarify, based on what you said, peptides can do absolutely anything. They can create sensitivity. That's the reason that symptoms are never weird. There's no bizarre symptoms because peptides can create anything. They can create a sense that you're just feeling weird in general. They can create anything at all. Okay. We're going to bounce back to YouTube. Mark R. said, power seems like the hardest to quote unquote master. I feel like I'm living a very powerful life, but sometimes we all feel out of power. For me, I have to sometimes accept that I can't make changes in everything, but take satisfaction in all the things I do have control over. I do have had a lot of fear. You can overcome it. So Mark is encouraging you all. Power, it's interesting. Is it the hardest to master? I think it actually depends on the person. I think that each column poses challenges for different people. But I will say that power is kind of universally the hardest. I understand what you're saying when you put master in quotes. I think I understand what you're saying, Mark. It's the hardest to feel that you have completely under control. A lot of times we bash doubt so much that it really becomes very minimized and we can almost laugh at it in a lot of ways. And the emotions column, we can usually get into a pretty well-rounded form where we feel like we understand ourselves and know what we're doing. I guess a way of putting what Mark's saying that I would agree with is that the power column is the most evolving one. And that's why I say to live in the power column, because you don't just stay there. However I'm feeling powerful right now or being powerful right now, there's going to be other ways. And I'll keep expanding. And that's part of the power column. Power is kind of like growth. You don't want to stop at any point in time. In the doubt column, you want to crush doubt and get it basically down to zero. In the emotions column, you want to figure out what your basic themes are. But the power column, when does growth actually stop? What I find is that it's just helpful to keep assessing, do I feel powerful right now or not? And if I don't, what's the thing that I need right now to return me to some kind of powerful feeling? And so I would look at it as exactly what Mark's saying, a flowing process. And maybe that's why it's hardest to master, but maybe that's a good thing. We could master certain levels or get to a certain point where we feel, a baseline, very powerful experience. What I do want to encourage you, though, is do not underestimate how much doubt is going to convince you can only go so far when you actually could go further. If you think about, for example, people who run for president and become president or become movie stars at some point, or rock stars or something like that, at some point they had to believe that could happen. I'm going to go for it. And there was a self-belief that they needed to get to that. Okay, now Thomas Roger has a follow-up. I understand what you were saying, but I find it hard to see how lack of power in some moments is what is perpetuating my supposedly chronic pain. I need to understand why increasing my power will allow me to beat my symptoms. I find it frustrating to hear that I need to work in the power column because I feel much more powerful than most people around me, and most of these people don't struggle with chronic pain. Okay, interesting. All right, so Thomas, first of all, I understand what you're saying and I can empathize with the frustration, but here's the thing to remember. First of all, just because I thought it was one thing at one moment doesn't mean I'm right. This is an example where you've got to decide for yourself. maybe I'm just wrong about that. Maybe this is just some lingering doubt. The only thing I was saying is that you have an opportunity to use the power column if you want to crush doubt even further. That's all I was saying. I'm not saying you have to do the work there or that you require that. So let's do a little bit of follow-up from that, because I think we may have been miscommunicating about what it was I was saying. I wasn't saying you have to work in the power column. I was saying you have an opportunity to work there to crush doubt. Let's see if that makes a difference, Thomas. Let me know. Okay, Christy Lee McKinney saying, hi, good to see you, Christy. Thanks for joining us here. All right, let's get back to Instagram. Oh, Lee Keckner, good to see you here, Lee. Lee says the pain is there to talk to us. Well, I absolutely agree with that in many, many ways. And the columns are 3 ways that it's talking to us. So, Lee knows some about my system. And, she's a like-minded spirit. She has her own way of thinking about it. We actually have a show that we have not yet released yet, but we filmed a couple of episodes. It's called The Opening. And it is about when people first encounter these ideas and are kind of grappling with them, trying to figure it out. So keep an eye out for that. We'll let you know when it's coming out. Catherine Toomer says, hi, Dr. Dan. Among my many other issues, no, not many, sorry. Among my other many issues, sorry, I that switched. I have a history of severe eating disorders. That was years ago. But there is still a part of me, not my conscious thinking brain, that thinks that as long as food is available to me, even if I don't eat it, everything will be fine. Due to my rule not to eat unless I'm hungry, then if I am not hungry, food is not available to me. So I feel I will not be okay. So when I'm full, I'm not okay. Such a weird but strong reminder to my eating issues. Remainder to my eating issues. I know I need a power column solution because when I'm completely full or a bit too full, I feel guilt, shame, and fear to be without food. Help with beginnings of an action statement. Well, first of all, let me give you some compliments here, because it's a big deal to recognize what you're recognizing. I think what you're showing is, hey, this lingering thing that I've gotten under control in a certain way actually can eat away with. Oh, what a hilarious way to put it. I did not mean that pun, but there it was. Can eat away at me, where I can just not be fully settled. So that's the power column work. I would say, Catherine, that the job we need to do is to understand, well, where did that come from? So I'd actually go back to your core narrative and find out, well, usually eating disorders relate to some kind of nurturance thing. It's not entirely surprising about that. But the question is, how were you not nurtured? And it can happen in so many ways. Some of them can seem very obvious. Some of them can be incredibly subtle. I'd want to think about that, because when it comes down to it, I think that eating disorders are all about power. They're often about this feeling that it is not okay to take up space, to be powerful. And so I know you're onto it. You mentioned the power column. But we want to think about how and why were you made to feel that power was not okay? Let's start there. You asked for an action step. That's the place I'd want to start. Okay, let's see. Rita says, hi, Dan. But I think she may just be saying hi. Did she have a question? No, just saying hi. All right, Rita, good to see you. Am Bam Williams has also joined us here. Thank you for joining us. Let's see, what am I missing? Okay. Scotty says, observing doubt and taking power away from the thoughts. Yes. Power column, finding self-empathy and fullness of my trauma. Thank you. So it is powerful to have self-compassion. Good to note. Very, very powerful, especially if it's real self-compassion. I did not empathize with myself at all until I invented my own power column. Or I guess maybe slightly before that, I found the symptoms taught me to empathize with myself. I really didn't. Intellectually, sure. I kind of gave myself a pat on the back. Okay, you're doing a good job. Yeah, some of these things were hard. I did not truly empathize with myself until I understood what the symptoms were saying. So to Lee's point, the idea that the symptoms are talking to us, they are. And if we receive that message in the power column, that's when we get relief. This also fits with what I was saying to Catherine. If you can understand what was that symptom of the eating disorder telling you, think of that as a symptom, because it was. What was it telling you? What's the message? Let's see if you can get that. All right. Michelle said, fear. I'm discovering that just recognizing when I'm in fear is the first step to overcome it, but it's a process. Great observation, Michelle. And it speaks to how important observation is. Just by seeing it, you can take that first step. Then you can start to think, okay, well, now that I see it, what do I do? A lot of times we see it, but don't see it. We experience it, but we don't see it. As an example, a lot of times if you ask people who are afraid, well, what are they afraid of? Essentially, they think the fear is real. They think it's completely right. They don't think they're having a fear. They think they are afraid of something that's real. And they have a lot of reason to think that. So observing it is a huge help. And I find this time and again in the people that I work with that whether it's going through the core narrative and doing the exercise of it to get in touch with the fullness of our trauma, or it's looking at the different columns and seeing how they're operating, people are getting insights into what's actually happening. And that's one of the reasons the column system really helps, is it does describe what is actually happening. Okay, Karen Isaacs, thanks for joining us here again. Karen says, different pains feel like a different emotion. So when I'm exhausted, even after a lot of sleep, that feels like sadness. Headache feels like I'm angry. And right this minute, it hurts when I swallow. Okay, Karen, you're making a great point. And I do want to say that for many people, symptoms do have a kind of metaphorical meaning. But they also have a personalized meaning. So I know how to recognize some of my symptoms. I think I've mentioned this before, but when I was having back pain, there were all kinds of different pains I would have, but some of them were different than others in ways that were very identifiable. One of them was I had this like adrenaline rush down the right side of my back. It was very, very specific and seemed strange to me. But as I came to see it, it related to competitive feelings. And when I thought about it that way, that's what would make those symptoms go away. So your symptoms are a roadmap of you. And the columns are a way to understand that roadmap. So keep looking at it. Karen, I think you're onto something. You know that this is the case. What you can do to extend that is to get even more specific about your understanding. So if you're having a headache and you're angry, let's figure out what about in specific, and then you'll have a chance to eradicate it. Right now, it's interesting that you're having something right now. It hurts when you swallow. So let's see what we can find out about what you're experiencing right now, because this is a chance to learn. Every symptom is a chance to learn, even though they're no fun. Some of them we don't want to learn too much. We just want to get rid of them, and I understand that. But a lot of times they're tolerable enough that we can just take the time to learn. So let's see if we can figure out anything about that, Karen, if you want to. If not, no big deal. Hopefully I'm not giving you things that are hard to swallow, but it could be that there are things that are hard to swallow in your life. Maybe that's the metaphor. We'll see. All right. Professor Pixel has joined us. Let's see. Catherine Toomer's response, she gave a smiley face and said, thank you. I know that's right on target. I'll work on it. Thank you. Thank you. You're welcome, Catherine. Yeah, check out all that power column stuff. I think you're going to get a lot of places just thinking about, all right, what did that symptom mean? A lot of times these things just were never unpacked. All right. Karen Isaacs had a follow-up. The headaches are 99% upon waking and an early morning bad dream. Okay, but I think you can get even more specific than that, Karen, and maybe you already do. But I want you to think about, well, what is it that you're waking up to that you're not happy about? Because that is the kind of thing that can make the symptom go away right away. Though you may be having an easy time getting rid of that symptom. I don't know, but let me know. All right. Professor Pixel asked, what would you suggest to someone who's been doing TMS work for 2 years now and still can't get rid of my back pain? I've done mediation, TMS therapy, somatic tracking, you name it. Okay. Thanks for this question. It's a great one. So interestingly, a lot of what I do relates to this. I would say that I'm kind of often falling into a niche of people who have been through a lot of this kind of work. They read Sarno. They've been to see some of the great people in the mind-body field who usually help lots of people, but then they're like, oh, it's not helping me. What's going on? And to me, it is simply about somehow the information is not getting organized or understood in the right way. I think the column system affords you the best chance of that. So I would recommend go to my website, www.crushingdoubt.org, and check out my seminars. The seminars are a way to take all of that information that you've gotten in the mind-body field and condense it into one easy to understand format that also explains why you haven't gotten better from all that work. So that would be my recommendation, because it goes directly to the heart of what you're asking. Why haven't you gotten better? Now, I'll give you the short answer, which is there are certain aspects that I find are not well represented in the mind-body field, or not represented at all. And I would say that doubt is touched upon in certain areas, but the level of its importance and how far it goes has not really been touched well before I came to this field and this space. And I'm doing my best to address how doubt operates. And doubt is the thing that makes symptoms stay for long periods of time. So that's what you're struggling with. In my experience, the mind-body field in general is talking way too much about emotional life. I call that beating your head against the emotional brick wall. And I think that's part of what's been going on for you. You need an explanation as to why your thinking has gotten bogged down in a given place. My system not only shows why that's the reason you've gotten stuck, but it also shows you what to do about it. Secondly, there's the power column. The power column is another area where symptoms come up in relation to particular issues that are not getting talked about much in the mind-body field. However, based on the way you're presenting and what you're saying, to me, is all about doubt. And the seminars can address that. So you can also email me if you want to talk more about this. It's dan@crushingdoubt.org. So let me know. Okay. Debbie Gladstone, good to see you. Thanks for joining me here. All right. Mark R. said, great explanation. Mark, I don't know what I was explaining at the time that was great, but I appreciate you sharing nonetheless. I'll see if I can go back and figure that was. Then he said, what I was trying to say, and then Mira, I'm going to jump back to you. What I was trying to say was that it seems harder to always stay in power, but I really like the explanation. At any given moment, each column could be easy or hard to quote unquote master. Okay, so now I obviously know what you were referring to, and thank you for sharing your thoughts on that and your appreciation about that, Mark. I do think it's really important to remember we're moment-to-moment beings. Things are always changing. And to me, the columns just describe what's happening. They're ways of understanding things. I do agree with you, though, that power is the thing that continues to be an evolving experience, and as a result seems the hardest to master. But I do think when we think about it as an evolving experience, that frees us up from worrying, oh, this is harder to master. Well, it's just a more free-flowing thing. It's about growth. Okay. Mira Lee, good to see you here. Mira said, hi, Dan. When I cry, my pain decreases a bit, but I have trouble getting the emotions out in tears. We've talked about this before, about not being able to cry. How do I work through this? And then, okay. Oh, I see. You were worried your question got skipped. I don't, well, I caught it anyway, Mira, but I was actually doing Karen's follow-up afterwards just because it flowed. And then Bob, I see you have a question too, so I won't miss that either. So, Mira, your question about the tears. There's many ways to work through this, but I'm going to suggest one in particular, and then I want you to follow up with me, okay? A lot of times I find that we put a lot of pressure on ourselves to have feelings come out in certain ways. And I used to feel, I guess I still do feel this some, a feeling like, I should be able to cry. There's something wrong with me. But one of the nice things about the power column is we learn to accept ourselves as we are. I saw this, I think her name's Anna Holtzman on Instagram, and she was saying, your trauma response is not a character flaw. And I feel like that's the kind of thing that applies here. It's like people like me and you who don't cry that much, Mira, we think, oh, it's a character flaw. I should be able to do that. I think there's many ways that it comes out. And one of the ways that it comes out is in symptoms. So I was talking about this in the group today. Sometimes the symptom isn't following emotions column lines so much and isn't following doubt column lines so much, but in the power column, it's like a symptom that's just expressing, it's as if we're crying. I mean, if your shoulder's hurting, you could think of that as crying. It's like a form of crying. And the first place I'd want you to go, Mira, is don't worry about what format it's coming out in. It's coming out. The body's always expressing it. I think what you'll find is as you receive that communication more, you probably will get to crying more, but don't put pressure on yourself about it. It doesn't matter. That's just crying, you could say, is a mind-body response, just like any other. So don't put pressure on yourself to get it one way or another. Mira, let me know if that answers your question. Okay. Professor Pixel had a follow-up here. Said, to note, my pain is way less than it was when it started, but I've just been stuck in limbo for a while. That's what doubt does. It gets people stuck. And actually, the power column relates to plateaus. So there's more information on that in the seminar. The two main differences that I bring to the table, to me, really are a good fit for where you're at. They can get you unstuck. So again, email me, dan@crushingdoubt.org. All right, Christy Lee McKinney says, I have a symptom that doesn't come around often, migraine/major stomach pain and dizziness. It was last year, 3 months ago. I thought it had to do with fear of, oh no, there's a cliffhanger. All right, Christy, finish your question and I will come back to you, but I can't answer it until you do. So we'll get to that shortly. Let me see if there's anything that I can say about it from what you've said so far. It was last year, 3 months ago. I thought it had to do with fear. Okay. I don't know if you got pulled away, but come back and answer that. It doesn't seem like I can answer anything about that in its shorter form. Anybody who have answered questions so far, please feel free to circle back and ask follow-up questions. But I did want to get back to Bob. Bob said, would power be similar to self-esteem or attitude or question mark? Great question, Bob. The way I think about power is it's about your relationship with yourself. So you could categorize it as self-esteem. You could categorize it as attitude. You could categorize it as any one thing. But the primary thing is, are you having a good relationship with yourself? And when I say that, I mean at a given moment. Now, there is the question of, are you having a good relationship with yourself in general? That's important also. That's a form of power. But I think of power as, are you feeling good or not? When you're feeling good, you're feeling powerful. When you're not feeling good, your power's down. And in the power column, I say there's two main tasks. One is basically know your basic core narrative and measure the moment you're in as to whether you're kind of back in the old experience or are you starting to expand beyond it? Are you starting to grow power and be that third sentence of the core narrative, see it kind of more enacted? Are you saying to yourself, I'm going to be fiercely in my own corner. I am gold. I deserve something better than what I had in these first two sentences. That's one task. The other task is, am I in power in the moment with myself, with others, or with my symptoms? And so if you're feeling good, that's power. If you're not feeling good, that's when power is missing. So I hope that answers your question, Bob, but please do follow up on that. What I hear in the question, interestingly, is doubt. What I hear is level 3 doubt. Will I ever be able to understand these terms? And what I want you to know is these terms, I can give you the ballpark idea of what they are, and then you need to formulate them as they work for you. So I want you to go with what feels right to you. Now, maybe that's part of the problem. Maybe you look at it from all different angles and you can't ever feel settled that you know what it is. But I've seen you get settled about things before. So I'm going to throw it back to you for a sec to consider that the challenge that you could make a decision for yourself about this. And whatever it is, it's got to feel right. So I would say another way of thinking about this, maybe there are questions here that need to be articulated. Why are you searching for a word? Not that doesn't make sense, but why specifically are you searching for a word? And what are you worried about if you don't have it? Or how do you distinguish between the two? We've got to get your questions answered, but to do that, we got to get them asked. And so I think that's the step we're on here. We're getting close to something, and this has to be settled somehow. Okay, Desiree Donaldson, thank you for joining us on Instagram. Looks like we actually have time for a preloaded question. Shocking. Usually we don't get preloaded questions available at this point in the evening. All right, Bob said, got it. Okay, I hope that does help, Bob. Feel free to bring that back to us next week, an articulated question, or if you have it now, go ahead and ask, okay? All right, let's get one of those preloaded questions in here. Oh, hey, Bob, I think this is from you. That's funny timing. Okay, Bob said, this was a while back, some emotional stuff gets repressed or stuck. My subconscious is holding on to and causing pain other than writing it all down with the emotions I've uncovered. How to get emotions unstuck, accepted. That's interesting because we actually kind of basically talked about this. The basic gist here, I think that if we look at the power column and we do exactly what we were just working on, we're going to get your questions articulated and then we can get them answered. So I wouldn't even worry too much about all of this repressed stuff. To me, it's all driving to the surface. It all wants to be known. It's going to be known if we just bring it out in the questions. That's my primary answer to that, Bob. Okay. Marilee has a follow-up. She says, yes, thank you. I want to cry because it helps the pain. Makes sense. But I will put less pressure on that now. Emotions tend to bottle up. I will practice sitting with the pain with self-love. Yeah, think about the pain as crying. I think if you do that, you're actually going to find the pain will lessen because it sounds like this is an experience where you are having a feeling that needs to be felt. It's the communication. The one caveat I'll say, Mira, though, is if it's bringing up doubt, you have to fight the doubt. And so I wouldn't worry too much about how the emotions get expressed as long as doubt isn't there. Let's remove doubt, and then we'll be able to know, is this a communication or is there something going on at that moment? Now, let me back up, actually. This is a better answer, Mira. What I said is true, but there's a broader answer, and broader answers are usually better. I think when you're having these kinds of symptoms, we don't actually totally know which column it is. I would look in all three columns. The good news is there's only three of them, but I would go ahead and look in each column. It could be in the emotions column that you're feeling something, but it's just not specific enough. So check there. Check for doubt. See if any level 1, 2, or 3 doubt has popped up. And if so, observe it, articulate, and counter it. And then lastly, in that power column experience, that is where you could sit with it and say, I think this is basically some kind of physicalized form of crying, even though hilariously, crying is physicalized. So it could be what I said, but I want you to look in all three columns. And that's generally the thing to do when you aren't sure. Okay, let's see if we have, no, it looks like we can get another preloaded question in. Let's bring that up. Okay, this is from Mark. Okay, so Mark sent me, this particular Mark, sent me a couple of things that were examples of questions he asked himself and answers that he then gave to show how he countered things. Here's what he said. It's just a point of interest and we can discuss it. Why did my symptoms jump with that one workout, skipping and riding the bike? His answer, was the skipping dangerous and was it something that you have never done before? The answer is no. I have skipped before and have not had any trouble. This should not have injured me at all. So this was him working through the logic of it. And he had really good success with this. When he was talking to me about these things, it was probably a couple months back now that he actually sent this, but I thought it was a good example of the way that people can engage in self-talk. The question for all of you out there as you think about this is, did it answer to his full satisfaction? Or would it answer to your full satisfaction? Because ultimately, it does not matter what I think. It matters what you think, because that's what you carry around with you. However, this one got it done for him. And that's good. That's the kind of thing to do in the doubt column. He got it articulated. Well, first he observed it, then he got it articulated, and then he countered it in a way that worked. And it allowed him to relax and think, I don't need to worry about this. What that probably was, based on the way the profile came across, is he probably was having some kind of emotional experience that was floating around, looking to attach to a particular symptom. That's how the defense works. And it pounced on a plausible idea. But as soon as he dismissed its plausibility by recognizing how ridiculous it was gone. So well done, Mark. Okay, guys, thank you again for joining me. It is a pleasure, as always, answering your questions. I hope that I've given good answers that can help you. If not, please do keep them coming. Or I guess if not, or if I have, please keep them coming, because the key to you getting better is to get your questions answered. That really is the case. Remember to distinguish between A and B questions, though. A questions are the ones that can get you real answers. B questions are the ones that doubt and fear have created for you just to try to stir up trouble. So keep an eye out for that. Now, again, we've got the seminars coming up May 9th. That's at 4 p.m. Eastern. And you can sign up on www.crushingdoubt.org. If you have questions about it, you can reach me at dan@crushingdoubt.org. And if you're willing to give a testimonial for any part of your experience in the kind of work that I do, the seminar, the group membership, the podcast, or the Mind Body Guides, you can reach out to Greg at crushingdoubt.org. He's managing that sort of thing. And it really does help us because it's spreading the word. So thanks so much. One last thing to mention, as I did mention, I do need editors. If anybody out there is interested in that work, or that's the kind of work they do, please do contact me at dan@crushingdoubt.org, and I will keep you posted on that. Bob says, thank you. Great Q&A. Thank you, Bob. And thank you all for joining us. One last comment. Catherine Toomer said, I think I got the idea that it's not safe to be powerful because my upbringing must have led me to feel that I cannot trust my instincts, but instead I just need to follow the rules. And the rules did not always make sense. You are on the way to something there, Catherine. I think that let's keep trying to spell that out. And we can even bring that straight to the next Q&A. Just bring a question in early. We'll jump right in on this, but keep up the good work. Regine Korn said, thank you. Thank you for joining us here, Regine. Good to see you earlier today. Karen says, I love spreading the word, as you see from Instagram posts. Yes, I do see that, Karen, and I very much appreciate that. We've all got to spread the word. We're working together here to get the whole world to understand this stuff. And I'm here to answer your questions. So thanks again for joining me. I will see you next week at the usual time, 6 p.m. Eastern, 3 p.m. Pacific. Thanks so much, guys.